Hi, welcome to Investing in Psychedelics. I will be one of your hosts. My name is Barrington Miller from the Canadian Securities Exchange. And today I'm here with Graeme McFarlane, CCO of Albert Labs. How are you doing?
Hi, Barrington. Good to talk.
Let's tell us a little bit about Albert Labs.
Okay, I mean, we formed Albert Labs towards September last year. I mean, our immediate reason for being is that we want to bring pharmaceutical grade psilocybin to the market, and in doing that, meet what is actually a very high and important unmet need, certainly in the UK and Europe. We are targeting with our psilocybin cancer-related distress. So that's anxiety, depression, existential crisis, which in itself is actually very, very high in its proportion with cancer patients, due in part to the treatment pathways, but also because there's a number of cancer patients at end of life and clearly are anxious, they're depressed, and their values are quite low at the moment. That's why we exist. How we're going to come to market, we've got 5 key pillars that I'll share with you very briefly, if I may. And that is our profile, proof, credibility, influence, and expansion. Now, with the profile, we are off to a flying start. We also have a sister company, which is a CBD company called CBD Science Group, and we've established already there a real-world evidence capability, which we're bringing to our psilocybin approach. We also have in cancer, because cancer is a key target there, an advisory board already established where we are actually connected to 5 key centres in the UK and will expand into Europe as planned. So that gives us an incredibly strong profile pre anything we do with Albert Labs. So, you know, already we're there. So I keep saying to people, this is not aspirational, this is actual. We're actually doing this now. So that's important to us.
And investors that will and are coming to the conference, what can they expect?
Well, I mean, IP is a big component here, isn't it? I mean, it's the title of the conference. And IP comes in many guises. The most obvious being, what is the product offer? Why is it different? Well, we're different in a number of senses. Our IP that's attached to our extraction capability, we are a laboratory-based clinical research organization, very much like a biotech company. And we're able to extract psilocybin in such a manner that we can actually claim, and we will, pharmaceutical grade psilocybin for use within the clinical setting. That's important, and that's an IP for us. On the proof side, again, this is back to IP as well. Real world evidence is actually highly regarded now. Real world evidence used to be introduced somewhat later in the research phases, probably towards 3 and 4. Now it's as early as 2 and 3. Now the numbers may mean nothing to you, but the actual length of time that you have to spend researching within the real world evidence component is somewhat shorter than would be the 5, 6, or 10 years that's sometimes spent on single molecule drugs. So from a proof point of view, which is one of the other pillars, we're going to do this rather quickly. We'll get this in front of patients very quickly. We'll establish a clinical habit, if you like, through experience. They'll actually be able to use it. And then we'll recognize revenues a lot quicker than you would if you had to wait 4, 5, and 6 years.
Well, thank you, sir. And to learn more, not only about Albert Labs, but a lot of the fine companies and people that we have attending this conference, check us out at Investing in Psychedelics, Building Value Through IP. I've been your host, Barrington Miller, and I'll see you soon. Thank you.